Actually, in my 23 years of experience, I have seen the burden of chronic kidney disease is increasing day by day. In fact, lot of patients who are visiting to a nephrologist or visiting to our OPD, outpatient department, the cause for their chronic kidney disease is long-standing diabetes and hypertension. Because of this uncontrolled sugars and uncontrolled blood pressure, which has not been controlled with the diet, exercise or regular medications, these people are having kidney disease. And this kidney disease is day by day, the prevalence of the kidney disease in our population is increasing. In fact, almost every out of 10 diabetic patients, 3 or 4 patients are having some amount of kidney damage in the form of rise in creatine, or they are leaking proteins in the urine. And this prevalence, I think, is going on increasing day by day. We know that chronic kidney disease is a silent disease, because the patients who are having chronic kidney disease, they usually don't have any symptoms. In fact, the symptoms will start in very late stage. Almost 70-80% of kidneys are damaged, then they will start developing the symptoms. So that's why chronic kidney disease is called as a silent killer. So those people who are having long-standing diabetes and hypertension, they should check their kidneys regularly. Don't wait for the symptoms, because symptoms like swelling over the legs, facial swelling, or loss of appetite, fatigue, or nausea, vomiting sensation, these kind of symptoms will appear very late stage. That is, almost 70-80% of both the kidneys are damaged, then the patients will start developing these symptoms. So most of the patients who are visiting to us, they are coming in very late stage. So don't wait for the symptoms, because these symptoms, when they start, they are already kidney disease is quite advanced. Particularly in diabetic patients, if they are started losing proteins in the urine, they will start getting swelling over the legs. They might find lot of froth in the urine. So when you see lot of frothy urine and swelling over the legs, might be a early sign in patients who are having diabetic kidney disease. But irrespective of the symptoms, all diabetic and hypertensive patients, they should check regularly. Don't wait for the symptoms. They can do the simple blood tests like creatine and the urine protein levels. These two simple tests will help you to diagnose the kidney disease in very early stage. We are seeing this diabetes and hypertension, which is not taken care properly and which remains uncontrolled for long duration, and the long duration of this uncontrolled blood pressure and sugar will damage the filter in the kidney, and people will start losing the proteins in the urine and their creatine will go up. So these lifestyle diseases, like people who are having excess weight, obesity, or they are eating lot of junk food, or they are putting on lot of weight and central obesity, the people who are smoking, so they are taking excess alcohol intake, all these lifestyle changes which is happening nowadays, because of these lifestyle diseases are coming quite early stage. So we are seeing lot of patients who are coming with high blood pressure and sugar in quite early, younger age rather than in the older age. So these people, almost 35 to 40 years, we are seeing lot of prevalence of diabetes and hypertension. And this lifestyle, if they don't do regular exercise, stop smoking, avoid alcohol intake, regularly sleep for 8 hours and regular exercise, will take care of their sugar and BP control and prevent the kidney disease. So this is the problem. The patients who are coming in very advanced stage of kidney disease, almost both the kidneys are damaged and they came in a stage of a dialysis, like they will require regular weekly, twice or thrice dialysis. These patients have the option of undergoing kidney transplant. So as my experience, because I'm experienced in both living as well as the deceased donor transplant, the main problem for these patients to undergo a kidney transplant is availability of the donor. Most of the times, living donor kidney transplant, the family members were willing to donate the kidneys. So in patients whose family member is not there or nobody is willing to donate the kidney, they can register under Jeevan Dan program for deceased donor, like cadaver kidney transplants. But main issue is there is a lot of waiting list, because so many patients and the prevalence of chronic kidney disease is almost increasing day by day, and lot of patients are coming for dialysis. Their waiting list is going up. So people are not getting kidneys and they have to wait on this list for almost 2 to 3 years to get a kidney. So awareness about kidney donation is very important, and the people should encourage about kidney donation, so that this waiting list we can make a short. We know the patients who are having permanent kidney damage, or what we call as a chronic kidney disease, who are in advanced stage like stage 5, they will require regular dialysis. And problem is, in a rural places or in the peripheries, the dialysis centers are not available at every place. So people has to travel, because once we start them on dialysis, they will require weekly twice or thrice 2 or 3 sessions of dialysis. So these dialysis centers which are not available to the nearest center, the people can't travel. So government is starting the dialysis unit in each and every district place, where people can go and do a dialysis at free of cost. But most to the interior part of the places where they can't access the dialysis center, we offer them an option of peritoneal dialysis, which is called CAPD, continuous ambulatory peritoneal dialysis, which is the procedure we can do at home. So we will fix a small tube in their abdomen, and special fluid will be given, which can be exchanged daily 3 to 4 cycles. So this is another modality of dialysis, what we called as a peritoneal dialysis. This will help them to do dialysis at home. Other modalities of dialysis like CRRT or slow type of dialysis, or patients who are very sick, what we do in our ICUs, this can be possible in a intensive care unit only. So other modalities where patient is very sick and they require SLED or CRRT, these modalities can be done in ICU setup. Yeah, we know that the prevalence of chronic kidney disease was increasing in the rural population also. Initially we thought it is in the urban areas only, because of these lifestyle diseases like uncontrolled blood pressure or uncontrolled sugar, which is causing the kidney disease. But we are seeing there is a rising number of patients or patients population in the rural area also. But main problem with the rural area people is it is detected in very late stage, because these people don't do regular tests, they don't follow up with the doctors, and they don't regularly check also. So problem to increase the diagnosis or early stage kidney disease, or we can do some preventive steps by increasing the education in rural population about the kidney disease. In fact, we advise all the people from the peripheries, we educate them, and we will advise them to do simple tests to detect the kidney disease in early stage, because rural population usually they neglect the health and they don't do regular tests, and that is the main reason the prevalence there is increasing compared to the urban population, because urban population they do regular tests and they will detect the kidney disease in early stage. So more awareness in the rural population is required to diagnose the kidney disease in early stage. We are seeing lot of kidney disease population, like kidney disease patients in a pediatric age group, like children who are having the kidney disease. The main reason for this is the late diagnosis, because the lot of in children or in pediatric group of patients, diagnosing chronic kidney disease is very difficult, because children usually don't come up with the symptoms too early, but still we can suspect, like by examining the children, like if they are getting swelling over the legs or swelling over the face, or they are passing less urine, or while passing urine they are crying a lot, or they are passing red color urine. These are the quite few symptoms. Or children who are not eating, they are continuously vomiting and abdominal pain. So these are the quite symptoms which can suggest that this pediatric population might be having a kidney disease. So routinely we should see these symptoms, and in fact we can do some scanning, because most of the children group kidney disease patients, they have congenital abnormalities, like there may be some pediatric patients might be having single kidney, or they might be having reflux, like urine is going in reverse direction causing urine tract infections. So these pediatric population, early symptoms will be the swelling over the legs, burning while passing the urine, or they are crying while passing the urine, they have to strain a lot while passing urine. And these people, those kind of symptoms, we should start diagnosing them early and to treat early, so that to prevent the further kidney damage. This is the 20th anniversary of World Kidney Day. This year the theme is Kidney Health for All, and the caring for the people and protecting the planet. So this year my advice to all people who are having long-standing diabetes or hypertension to do regular checkup for their kidney health. So they should check their kidneys by doing two simple tests: urine albumin creatine ratio, that is a protein loss in the urine, and the serum creatine. This is a simple blood test which can detect the creatine levels in your blood. So these two simple tests can help you to diagnose the kidney disease quite early stage. So don't wait for the symptoms, because symptoms sometimes might appear in very late stage of chronic kidney disease. But still, if you are finding swelling over the legs, swelling over the face, difficulty in breathing, and appetite is going down, so better to check these two tests and report to the nephrologist as early as possible. Thank you.